Please start it.
Thank you very much for the introduction. It is actually not my work what I have to present. It's a cooperation of the clinic. I have the pleasure to be the head of the Wittek Uni ruminant clinic, and as a member of my team, Birgit Altenbrunner. And as you can see, there's a cooperation to the University of Medicine in Vienna and the MSD, which we all work together here in this. And I'd like to present the results of the study to you. It is about the phenadine, which is a non-steroidal anti-inflammatory drug, and it has been recently introduced as a pour-on application. But the instruction is saying that it has to be applied on the dry skin, and wet conditions have to be avoided for at least 6 hours. Pour-on, of course, they have advantages. It is less stressful for the animals, and it's not pain by injection. But the question still remained, is there an adequate absorption when it starts to rain, when we have wet conditions? And this was the point we were starting from. So our hypothesis were that absorption might be decreased if it's raining when or immediately after the drug has been applied, and then that the intensity of rain, so it could be light rain or heavy rain, might have a different impact on the absorption of flunixin. What we did, we tried to simulate rain, and we had these 9 of these nice male Holstein Friesian calves. They were kept in our premises at the university. When we started, they were 14 days of age, and they were fed milk replacer and kept in groups in a barn on straw. We used a greenhouse irrigation system to simulate rain. You can see the picture here. It's just sprayers spraying water, and you can, of course, adjust this for the intensity. And the calves, after the procedure were over, they were dried using a professional hair dryer, which was originally designed for dogs. But it worked well for us. The intravenous catheters was placed in the jugular vein, and then we put around such a nice yellow bandage to protect the vein. Blood samples were taken before treatment, and then, as you can see, 15, 30, 60 minutes, 120, 240, and then 6, 12, and 24 hours after application. And the catheter, the intravenous catheter, were always removed immediately after the last sample had been taken. Not going to go deep into the material methods of the analysis, just to tell you that the HPLC system, the procedure had to be adapted to bovine plasma, and the people working with us from the medical university, they did a really good job to do this for us, and they did a calibration, and so we had a linear calibration curve, which worked really well for us. Sorry. Just coming to the results, stay a little bit longer here. The blue line, this one, these are the control cows. So we used the cows as shown you in a Latin square design in a different order. So the blue line, this is the control calves, and we had, at first, the light rain starting immediately after the drug has been applied, and this is this line here in light blue. So you can see, just from looking at the maximal concentration, you can see there must be an effect, and there was. There's also the green line. Raining started 30 minutes after the drug has been applied, and then a little bit a surprise for us when rain started later 60 minutes and 4 hours after the drug has been applied, it seemed that the Cmax was actually increased. This is statistically not significant, this effect, but it numerically it looked like it is a kind of facilitation of absorption, which, as already said, it is not significant, so there's no effect. So just to summarize the results, light rain, just when it starts immediately after the drug has been applied, significantly decreases the absorption, and in contrast, when it starts later, so after an hour, later than an hour, it seemed to have a non-significant positive effect on absorption. It's always a little bit too fast here. Okay, heavy rain. Heavy rain, more than 7.5 millimeters per square centimeter. Again, the blue line is the control. Here, heavy rain started 60 minutes, and the red line is 240 centimeters. Although starting 60 minutes after application, as you can see, the Cmax is pretty much the same. There's no difference, but then the concentration goes down pretty rapidly. And when the heavy rain started 30 minutes or immediately after the drug has been applied, we have much lower Cmax of the drug. Summarizing this, it is that when heavy rain started immediately after the drug has been applied, 30 minutes and even 60 minutes after application, there was a significant reduction of the absorption of flunixin when applied on the skin. When the rain started 4 hours and later after application, there was no effect. So just showing you the area under the curve. This is the control. As you can see on this side here, this is light rain, and on this side is the heavy rain. And this basically it confirms the results which we have seen, showing you the concentration time curve. Area under the curve was decreased, light rain starting immediately after application of the drug. On the heavy rain side, and the heavy rain started immediately, 30 minutes and even 1 hour after application. There was the absorption was significantly decreased by the rain. The machine doesn't work for me, as you can see, but going back again. So just to conclude it, so irrigation means rain had a significant effect on the absorption and bioavailability of flunixin after the transdermal application. And this has to be considered if the product is used. So whenever possible, animals should be kept inside. If it's not possible, we have to tell the farmers, or if we do it on ourselves, we have to assess the condition. If it's just a light rain, animals should stay in an hour, and if it's heavy rain, the animals should be protected from getting wet for a minimum 4 hours. Thank you very much. That's all I have. Thank you.